Okay, so good morning everyone. Today we are going to be starting our finals coverage with our gastrointestinal system drugs. Um, so we will discuss the following drug classifications: antiemetics, antidiarrheals, laxatives, and anti-ulcer drugs. But for today, I will discuss the first three only. For the next meeting, I will discuss the anti-ulcer drugs because medyo daghan-daghan man sila. So second meeting. Now let's talk about anatomy first, specifically anatomy for our antiemetics. Now, what anatomy here is relevant? No? Here we have class our what we call chemoreceptor trigger zone or CTZ. Okay? Our CTZ. Now the CTZ class, typically they receive stimulus. Okay, receive stimulus from from toxins, drugs, and the ears. Remember class that the ears are used for also balance. Okay? And then they will transmit that signal, they will transmit that stimulus, okay, to our vomiting center. Okay? Aside from that class, our chemoreceptor trigger zone is also activated by our neurotransmitters, specifically our acetylcholine, dopamine, histamine, and serotonin. Okay? And then that will be transmitted to your vomiting center, wherein it can be activated by either noxious odor, smell, and taste. But eventually, it will lead down to what we call vomiting. Okay? Vomiting. Now, what I mean by that is very simple. No? Like for example, class, if there is a sudden increase in, let's say for example, acetylcholine, then that acetylcholine will go to your chemoreceptor trigger zone, and then it will activate also the vomiting center to elicit vomiting. Like another example could be like if you lose balance for a long time, let's say you are drunk, you are intoxicated, then there is a tendency that the chemoreceptor trigger zone will receive that stimulus, and then that it will send that loss of balance stimulus to your vomiting center, which will cause you to vomit. Okay? So we've been talking about a few different concepts before. I want to highlight the difference between nausea and vomiting. Okay? Now what is nausea? When we say nausea, it refers to the feeling of a queasy and uneasy feeling. Okay, queasy and uneasy feeling of fullness. It's very similar to being very full class. Like, puno na ka ba? No? Puno na yung imong stomach. It's like that. But it's queasy. It feels like it's coming out. Whereas vomiting, you already know what vomiting is. Vomiting is the expulsion, the rapid expulsion of food and food-related products. Okay? Now, if this vomiting class is severe, then it might lead to what we call our dehydration and alkalosis. Nga alkalosis man, why is it alkalosis? It's because, class, when you are vomiting, you are most likely vomiting away hydrochloric acid. And if you vomit away hydrochloric acid, then it will lead to metabolic alkalosis. Okay? So let's start with our first drug class. It's our antiemetic, first drug classification, antiemetic. These are drugs that suppress or stop vomiting. Okay? These are drugs that suppress or stop vomiting. Now, there are a few different classifications of antiemetics, but we can categorize them into two. Our non-prescription and our prescription. Okay, now here's the thing you need to remember about antiemetics. Often, they are given with non-pharmacologic measures. Okay? Non-pharmacologic interventions na lang. Interventions. Okay? As support. No? So when a patient is vomiting, oftentimes we use our non-pharmacologic measures first. If it doesn't work, we will continue with our non-pharmacologic measures, but at the same time, we will now give them an antiemetic drug. Now, what are our common non-pharmacologic measures? No? So, dagan kayo administration of weak tea. Kaya bitong tea class tea without sugar. No? Gelatin. Administration of gelatin. Plain crackers. Like for example, class, your Skyflakes. That's a plain cracker. And increasing oral fluid intake. Okay? Now, here is our drug classifications. What's the difference between non-prescription and prescription? Aside from requiring a prescription. Oftentimes, class, kini mga non-prescription, here's the thing you need to remember, ha? When it comes to non-prescription, this is frequently used for vomiting. Kini, muna siya kidre. Caused by motion sickness. Okay, vomiting caused by motion sickness. But it is not effective. Not effective against other causes. Okay? It's not effective against other causes. No? For prescription naman po, class, for prescription, it is effective against other causes. Diba? Effective against all other causes. Now, we will discuss them one by one, no? We will discuss them one by one. Okay? Starting with our non-prescription. Our antihistamines. Now, you already know what our antihistamines, no? We have our dimenhydrinate, meclizine hydrochloride, and our diphenhydramine. Their action is to inhibit vestibular stimulation in the middle ear. When we say vestibular stimulation, this is the part of the inner ear that causes balance. Therefore, preventing motion sickness, which leads to vomiting. Kini sila ng mga tambal as our non-prescription antiemetics. They can also be used for motion sickness. They can be used for seasickness. No? Now, the thing you need to remember, class, are side effects. Side effects are similar to anticholinergics. Okay? So, sa mga side effects, class, when we say anticholinergics, class, remember, anticholinergics, class, it is SNS stimulation. So, na ay drowsiness. Drowsiness, di ba? Dryness of mouth. Natay constipation. Okay. No? Since I have mentioned before, this is used for motion sickness. Motion sickness often happens because when a patient or person is traveling. Okay? If it's traveling, no? So, this is effectively given, no? Effective if given 30 minutes before travel. Okay, before travel. It's very important because um, it might take a long time, mga good class, no? However, class, it is ineffective if given after vomiting. Di ba? No? Because ang tendency, mga good class, is if you give this after vomiting, then there's no effect anymore. Because the action of our antihistamine, antiemetics is to prevent, di ba? Remember, to prevent vomiting or to stop vomiting, no? So it's kind of useless if you're gonna give it after the patient has already vomit. Okay? We have another non-prescription class, our our bismuth subsalicylate, our Pepto-Bismol, and our phosphorated carbohydrate or our Emterol. Okay? Now, these two class, I'm bundling them together because they are very similar. They are very similar class, no? For these two class, I want you to remember that they are often in liquid form. Or, if dili guys sila liquid class, it's for chewable tablet. Okay, so you can crush these tablets. Okay, now bismuth subsalicylate acts directly on the gastric mucosa to suppress vomiting. Okay, acts directly on the gastric mucosa to suppress vomiting. Now, I want you to keep in mind that bismuth subsalicylate is a salicylate or salicylic acid. So it has a very similar composition to aspirin. Very similar composition to aspirin. So, the thing that you need to remember about this drug is avoid giving it to children. Avoid giving to children less than 8 years old. Diba? Nga naman, because there is a risk for Reye syndrome. Okay? Reye syndrome. This is the reason why, class, we don't give aspirin to children less than 8 years old because there is a possibility for Reye syndrome. Okay? Number 2 is this is contraindicated. Contraindicated for patients at risk for ulcers. Diba? And bleeding. Because remember, class, your aspirin can cause ulcerations. And as a blood thinner, it can also cause a bleeding risk. Diba? So we don't give this class very similar effect to our aspirin. Okay? And then you need to watch out for, similar to aspirin, tinnitus or the ringing of the ears. Because this is the toxic sign. Toxic sign of Pepto-Bismol na. Okay? Next is our phosphorated carbohydrates or Emterol. The action of these drugs is decreases nausea and vomiting by changing the gastric pH and decreases smooth muscle contractions. When we say changing the gastric pH, class, it will turn pH to slightly alkaline. Okay? That is to prevent hyperacidity. Now, what do you need to remember? What are the nursing considerations when it comes to these drugs? No? Number 1 is contraindicated. Contraindicated for patients with diabetes mellitus. Ano man? Because this is carbohydrate-based. Daghan og sugar. No? So, dili na siya pwede. Another is that we need to monitor blood glucose closely. Di ba? Monitor blood glucose closely. But the thing you need to remember is that since they are non-prescription, kini sila, non-prescription, they have very few side effects, often very little side effects. No? Gamay na kaya sila mga side effects, class. And because of that, they are able to be sold, no? They are able to be sold as a non-prescription drug. Okay? So let's start now with our prescription. Here we have our prescription antiemetics. Now the first one we're going to discuss is dopamine antagonist. Okay? Dopamine antagonist. Remember, class, you have to go back up. Okay? Remember that dopamine can also activate the CTZ, and the CTZ will activate the vomiting center. So, an excess in dopamine can also induce vomiting. Can also induce vomiting. That's why, class, we can give them a dopamine antagonist. When we say antagonist, they will stop or reduce the number of dopamine. So the action of these drugs is to suppress vomiting by blocking dopamine 2 receptors in the CTZ. Okay? And there are 3 classifications subdivided here. First is our prochlorperazine and our promethazine. These are what we call, class, our phenothiazides. These are antipsychotic drugs. Okay? Next is our droperidol and haloperidol. This is our butyrophenones. Okay, these are also antipsychotics. And then lastly, class, is our lorazepam. This is a benzodiazepine. A benzodiazepine, class, is an anti-anxiety or an anxiolytic. Now, when do we use this, class? Listen, ha. When do we use this? Number 1, for our phenothiazides, we use this often for nausea and vomiting caused by surgery. Okay? Anesthesia. And chemotherapy. Okay? They act by inhibiting dopamine in the CTZ. Okay? They act by inhibiting dopamine in the CTZ. Our butyrophenones, class, no? They block. Ang nakalayan nila, class, is they actually block the receptors. Block dopamine, okay, receptors in the CTZ. Okay? Often they are used for post-op nausea and vomiting. Vomiting associated with toxins. When we say with toxins, class, that includes alcohol, ha? And radiation therapy. So patients who are undergoing radiotherapy, class, oftentimes could also get nausea and vomiting because it can cause them to have motion sickness. So we can use our butyrophenones, no? Whereas our lorazepam, class, is a very indirect control of nausea and vomiting. Okay? Indirect control of nausea and vomiting. Now, the thing you need to remember about these drugs. Okay? And lagyan mo ito ng malaking star, class, ha? Don't forget this, please. For the love of God and all that is holy. Please do not forget this, ha? All these drugs, okay? All these drugs are CNS depressants. Okay, so they will slow down or depress your CNS or central nervous system. So what do you need to remember? You need to watch out for respiratory depression. Okay? Depression. Remember that your lungs are being controlled by your central nervous system. So if there is a problem or a depression in the central nervous system, your lungs will also be depressed. And you can see this often, class, as an increase in respiratory rate but a decrease in SpO2. Eventually, it will be a decrease in respiratory rate and SpO2. Okay? So at the start, it will increase the respiratory rate But as it goes along, as the lungs become weaker and weaker, and eventually there will be a decrease in respiratory rate. Okay? So what do we need to consider? Okay, number one, if given to patients with cancer, give the night before the treatment, the day of the treatment, and 24 hours after the treatment. Plus, this is applicable only for pheno. Okay? Thiazines. Thiazines, okay? Kini silang duha. Thiazides, okay? Phenothiazides, okay? The side effect class is sedation and EPS. When we say class EPS, we are referring to our extrapyramidal symptoms, no? Extrapyramidal symptoms. You need to remember four. There are four symptoms of extrapyramidal symptoms. First is akathisia. Okay? Akathisia class is restlessness. The second symptom is our dystonia. Okay, dystonia is involuntary muscle contractions. Another is our Parkinsonism. Okay, this is slow movement. Slow movement plus tremors. Okay? And then lastly, class, is our tardive dyskinesia. Okay, tardive dyskinesia. This is lip smacking and tongue thrusting. Lip smacking and tongue thrusting, no? So, since there is a sedative effect, avoid driving and operating heavy machinery and monitor the patients at all times. Now, what do you need to do, class, if any of these side effects happen? Remember, especially if EPS ang mugawas, class, please report to the physician. Okay? Now, these side effects, class, these are only common, okay? Only common for our phenothiazides and our buterphenones. Okay? And lastly, monitor the patient's vital signs, especially RR, because as I mentioned before, these are what we call CNS depressants, no? So, this is applicable for all three classifications. Okay? So just keep that in mind, okay? Keep that in mind because they are all CNS depressants. Next is our serotonin receptor blocker. They suppress nausea and vomiting by blocking serotonin. The serotonin receptor 5-HT3 in the central in the chemoreceptor trigger zone. Okay, remember that similar to our dopamine, serotonin can also cause your CTZ to be activated and activate the vomiting center. So there are a few drugs here, class. Our ondansetron, our ganisentron, and our dolacentron. This is kini sila, class, actually these are the most common antiemetics, especially ondansetron. Okay? So what do you need to remember about these drugs? They are very effective, di ba? Very effective at suppressing Nausea and vomiting caused by chemotherapy. Ayan. No? The good thing about this is since this is not an antipsychotic or anti-anxiolytic, there is no EPS side effect. Dili man siya anxiolytic, di ba? It's not an anxiolytic, it's not an antipsychotic. So there's no EPS. For our side effects class, no? These are side effects that are common, but they are not reportable. Headache, diarrhea, okay, dizziness, and then fatigue. So you just need to intervene individually, class, when it comes to your side effects, no? Okay, now let's continue, no? This next drug class mo ni siya ang pinakasikat. This is the most famous antiemetic class, our metoclopramide. Okay, or Reglan. Metoclopramide, metaclo, no? This suppresses emesis by blocking the dopamine receptors in the CTC, so similar to our dopamine dopamine antagonist. But the difference is metoclopramide is not a antipsychotic, nor is it nor is it a what we call anxiolytic, no? So this is usually for post-operative emesis and chemotherapeutic emesis, so vomiting caused by post-op or chemotherapy. High doses can cause sedation, no? So sedation gani class, no? It's a sensation of drowsiness or a sensation of loss of consciousness. So instruct patient to avoid driving and operating, okay, heavy machinery, di ba? We've done this before. Balik-balik tag-discuss ni class, no? For diarrhea class, it can also cause diarrhea. So what do? You need to intervene with diarrhea class by increasing oral fluid intake to prevent dehydration. Okay? Now what else? What else can we do? What do we need to remember about metoclopramide? No? Another thing that we need to remember is that this is contraindicated for patients with GI obstruction. Okay, like for example, a tumor in the GI tract. Patients with bleeding or hemorrhage. Okay, hemorrhage. And patients with a perforation. When we say perforation, it could be a hernia. Perforation. Hernia, no? Now, at least one class, lagyan mo to ng malaking star class. Another thing you need to remember about metoclopramide is that you need to administer 30 minutes. 30 minutes. Okay? Before meals and at bedtime. Okay? So, muna siya mga usual time na you can give our metoclopramide. Now, here are some general nursing considerations for all antiemetics. Number 1, check vital signs. Specifically, check for shock-like symptoms. No? When we say shock, mangod class, this is most likely due to dehydration. Okay? Because of the vomiting. Now, what we are looking for here is hypovolemic shock. Hypovolemic shock, which is shock that is caused by a decrease in fluid volume. And oftentimes, these are the signs and symptoms because it will have hypotension. Okay? We have tachycardia, and tachypnea. Okay? Muna siya mga signs and symptoms of shock. Okay? If the antiemetic has a sedative effect similar to our dopamine antagonist, no, and our metoclopramide. Avoid alcohol because alcohol is also a CNS depressant. If you give a patient, let's say for example, you give a patient lorazepam, okay, and then the patient drinks alcohol, then there's a very high chance that their CNS could be depressed. And because of that class, their respiratory rate drops because it can also cause respiratory depression. Okay? Monitor bowel sounds. Normally, class bowel sounds should be around 5 to 30 sounds per minute. Okay? 5 to 30 sounds per minute. Advise pregnant patients to avoid antiemetics during the first trimester. Why is it first trimester? Because class, these drugs are oftentimes teratogenic, and the first trimester class is crucial for organogenesis. Okay? The first 8 weeks is a class, first 8 weeks, no? First 2 months, no? So, do not give during this time. Okay? Do not give during this time. Focus on non-pharmacologic mechanisms first before giving drugs. So if it doesn't work, muna na siya matag time na matag drugs. Okay? Next is our anti-diarrheals. These are drugs that are used to treat diarrhea. Okay? When we say diarrhea class, this is excessive defecation. Magsigi o kalibang. Sigi o kalibang. Excessive defecation. Okay? Now remember class, since it is excessive defecation, there is always a risk for dehydration. And because there is a risk for dehydration, there is also a risk for hypovolemic shock. Okay? Hypovolemic shock. Now the thing you need to remember is that the general rule, okay, but the black day. The general rule for our anti-diarrheals is never use for more than 2 days. Okay? And never use if fever is present. Okay? Lagyan mo yan ng malaking star class, no? What happens, Manggol, is this. If you use it for more than 2 days, that increases your risk for dehydration very greatly. Taho kayo chance ma-dehydrate, anak. And if the patient class has fever, you don't want them to lose fluid volume because the fluid water acts as a sort of buffer, no, for the temperature to go around. Diba? So, also, this will also prevent dehydration during fever. So we have 3 types. Our opiates and opiate-related, our anti-secretory agents, and our adsorbents. No? So let's talk about it. This is our small and large intestine class. Usually the food passes through our large intestine first, and then our small intestines first, no? And then it will enter our cecum, no, going to our large intestine, paana na siya diri, no? And there are a variety of reasons why, but remember class that most of the time the main mechanism for the movement of food is what we call our peristalsis. Okay? Peristalsis, okay? Peristalsis class is the contracting and relaxing pattern of GI smooth muscle. Okay, contracting and relaxing. And what happens there is if the food is here, class, and this part here contracts, it will propel the food forward. Okay? And then after it moves forward, this part will relax. Mo relax siya, and then this one will move forward, or this one will contract. So it will propel the food further and further down the GI tract. Okay? So yan na siya, very simple, no? So what is diarrhea? Tita Historiana, what is diarrhea? Diarrhea, class, to be honest with you, it is frequent, that's the keyword, in liquid stool. Okay? Remember, intestinal fluids are rich in water, sodium, potassium, and bicarbonates. Okay? And because of that, class, if there is diarrhea or an excessive defecation, there is a very high tendency for metabolic, okay, acidosis. Na makayo ka na ko sir nga acidosis naman karon. Okay? Remember class, in our emesis, we are removing mostly hydrochloric acid and food from the stomach. But the diarrhea class, since there is a lot of sodium and potassium and bicarbonates, we are removing a lot of electrolytes. So, this metabolic acidosis stems or is caused by electrolyte imbalances. Okay? This can also cause dehydration. Okay? This can cause dehydration if severe diarrhea. And dehydration class is very, very dangerous. Very, very dangerous, no? So, when we talk about diarrhea, there are a few pathologies. When I say pathologies, class, this is the mechanism of how it happens. Okay? So, first class is osmotic pathology. When we say osmotic, it means that the solutes fail to be absorbed. Okay? Okay? The solutes fail to be absorbed, leading to water in the gut. Okay, water in the gut. And if there is water in the gut, class, it promotes faster defecation because it will make the stool much more watery. No? It will make the stool much more watery. Okay? For secretory class, no? The intestines secrete more fluid into GI tract. Into the GI tract. Than it can absorb. So same gap sa mechanism class, there is more water in the gut. And because there is more water in the gut, it can lead to what we call watery stools. Watery stools. And remember, watery stools class are very fast. No, paspas na sila mo gawas, no? That's why in diarrhea class it's a frequent liquid stool. Okay? Next is our inflammatory, caused by inflammatory processes, no? In inflammatory mongol class, it damages the intestinal lining. Okay? That leads to loss of blood. Loss of blood. Okay? Proteins and mucus in stool. Okay? Now, since there is damage to your intestinal lining, most of this blood, these proteins, and this mucus, will go to your GI tract. Okay, will go to your GI tract. And remember, blood is liquid. Proteins tend to pull water to wherever the protein is. So in the ending class, it will also cause water in the gut, leading to a watery stool. Diba? Very similar mechanisms, but they're very different starting points. Next is malabsorptive. This is when the GIT, the GI tract, fails to absorb nutrients and water. Okay, nutrients and water properly. So, ang result na class is there is similar to ganina class, water in GI tract. Okay? Lastly, class is peristaltic. This is when the GI smooth muscles, okay, contract uncontrollably. Okay? Uncontrollably. Oftentimes that's very fast. When we say uncontrollably very fast, peristalsis. Muna na siya class, that leads to rapid expulsion. Rapid expulsion of stool. Okay, rapid expulsion of stool. No? There are a few types we need to remember. First is our opiates and opiate-related drugs. Okay? Wait sa ha. Okay. So these slow down intestinal motility, thereby slowing down peristalsis. Now, how do they slow down intestinal motility? Because these are CNS depressants. No? So, the first thing you need to remember when it comes to these drugs is avoid alcohol. Di ba? Avoid alcohol as these are CNS depressants. And it could lead to respiratory depression. Okay? Which is number 2 class, no? Report signs of respiratory depression. As I mentioned before, ganina, di ba? There will be an initial increase in respiratory rate followed by a decrease in respiratory rate, no? So number 3, watch out for drowsiness and dependence. Okay? When I say dependence, class, it has a tendency of making the patient dependent on this drug. Ma-addict sila ni na drug, no? So you already know what to do with drowsiness. Avoid driving and operating heavy machinery. Number 4, the fourth nursing consideration is the most common side effect here is constipation. Okay? This is rebound constipation because if you take a lot of antidiarrheals, pampakalibang, okay, for a long time, then your body will stop moving on its own na. And then when you suddenly stop taking antidiarrheals, then it will lead to constipation. No? And number 5, okay, this is contraindicated in patients with hepatic impairment na ay problema sa iyang liver. Okay, impairment. Because these drugs are metabolized in the liver. Lalagyan mo ito ng malaking star class since this is an opiate. Since this is an opiate, always prepare. Okay? Gusto tayo mo i-prepare class na naloxone. Okay? Naloxone. Di ba? Because naloxone class is an opiate antagonist, no? An opiate antagonist. Wait up. So it can be it can be beneficial, no, to take naloxone if there are signs and symptoms of what we call overdosage. Wait up. Naloxone, okay? So, anda mo na nimo. Next is our anti-secretory agents. There's only one anti-secretory agent ni siya. No? This is our octreotide. This activates somatostatin, okay, which reduces the secretion of fluids in the GI lumen. So, reduces the secretion of fluids and electrolytes in the GI lumen, leading to a decrease in water and electrolytes in GI tract. And because of that class, it will produce solid stools. Gahi ang imong tae. Gahi ang imong tae. So that is our octreotide. No? So what do you need to remember when it comes to this drug? Number 1, monitor for dehydration. Okay? And so what are the signs and symptoms of dehydration, class? Decreased urine output. These are just some, ha? Decreased skin turgor. Pale pallor. And dry mucous membranes. Like the inside of the mouth are dry, no? Kana. So muna siya signs of dehydration. Kini. Very important. Lagyan mo to ng number star for number 2. Okay, lagyan mo yung malaking star. Hold if diarrhea. Okay? Continuous for more than 48 hours. As I mentioned before, class, dapat we should not be giving antidiarrheals for more than 2 days. Okay? More than 2 days. And number 3, observe caution in patients with glaucoma, okay, liver disorders, and ulcerative colitis. Okay? Serve caution in those. There are very specific interactions, Manggod, with octreotide towards these specific conditions. Okay? Next is our adsorbents, no? Now, adsorb means, what does adsorb mean? No, it is to engulf. Okay? To engulf the membrane. Okay? So what is this action? It coats the wall of the GI tract, adsorbing bacteria and toxins that cause diarrhea. So if this is the GI tract, class, okay, if this is the GI tract, and the green one here is the food bolus. It's moving forward, okay? What our drug does is it will coat, no? It will coat the wall. Himuan na niya murag barrier dira, kasi it will coat the wall so that toxins, okay? Toxins or bacteria, okay, or water cannot enter the GI tract. So that it cannot enter the GI tract and it is allowed to freely pass, no? The stool is allowed to freely form and freely pass through your GI tract without coming into contact with bacteria and toxins that can cause diarrhea or even water, no? So there are two. One that I mentioned before and already, you already know, is our bismuth subsalicylate. Okay? So what you need to remember about the bismuth subsalicylate is it has similar nursing considerations. Similar nursing considerations to the one up top, di ba? Katong nasa taas, same rin na sila ng drug, they are the same drug, no? Our kaolin pectin, okay, kaolin pectin. Number 1, the thing that you need to remember about this drug is administer PO meds. Okay, PO meds 2 hours before, okay, and after to prevent a decrease in absorption. Okay? What I mean by that is since the toxins cannot enter, okay? Toxins cannot enter, di ba? Nutrients cannot also exit. Nutrients cannot also exit. So it's much better to give this drug 2 hours before or 2 hours after so that the drug will not interfere with the absorption of nutrients. Okay? Number 2 is this is contraindicated. Contraindicated in patients with severe abdominal pain. Because this might, this might interfere with diagnostic procedures. Okay? And then number 3 Number 3. Okay? This is contraindicated. Contraindicated in patients with under 3 years old. Okay? Contraindicated in patients under 3 years old. Now remember, these 3 drug classifications, they are anti-diarrheals. Meaning to say they will prevent diarrhea. They will prevent diarrhea. And they will prevent diarrhea by either slowing down the movement of stool, similar to your opiates, no? Slowing down peristalsis, okay, slowing peristalsis, or they can make the stool much more solid by decreasing the amount of fluids, like your anti-secretory agents and then your absorbents. Okay, what are our nursing considerations for all antidiarrheals? Number 1, monitor vital signs religiously. Okay, report a decrease of systolic blood pressure of 10 to 15 mmHg or tachycardia. This is indicative of shock, as I mentioned before, hypovolemic shock. Monitor the frequency of bowel movements and bowel sounds. Okay, drugs may be withheld if diarrhea continues for more than 48 hours. As I mentioned before, antidiarrheals should not be given for more than 2 days. Okay, advise the patient to take the drug as prescribed and encourage the patient to drink clear fluids. If you have ever wondered what a clear fluid is, the easiest way to distinguish is that a clear fluid is a fluid wherein light is able to pass. Okay? Light is able to pass. Tagahan mo example, class. If it is coffee, regular coffee without any other adulterants, no, that is a clear fluid. Because if you shine a light across coffee, then the light is able to pass. But if you mix coffee with milk, then that is no longer a clear fluid. Okay? That's not a clear fluid anymore. That is a full fluid or full liquid. Diba? Full liquid tawagan ha. Because you're no longer able to pass the light. That's the difference. That is the easiest way to differentiate the both. Diba? Next is our laxatives or cathartics. Okay? Listen to me. Laxatives, class, these drugs are used to eliminate fecal matter. Saan ang fecal matter, class? Tae. Okay? This is indicated for patients with constipation. Okay? Constipation. No? Kung saan man ang constipation, class, constipation is if you cannot defecate. Di ka kalibang. No? The previous 3 drug classifications were for diarrhea. If there is too much defecation, then these drugs will slow the defecation down. But our laxatives or cathartics, they are used for constipation. Instances wherein the patient cannot defecate. Okay? So what do you need to remember? Avoid if there is positive intestinal obstruction. Okay? Why? Because if you force the patient to defecate and there is an intestinal obstruction, this could lead to an increase in GI pressure. And because of that increase in GI pressure, it could also lead to GI rupture. And we don't want GI rupture because it can cause peritonitis, no? Avoid also, class, if na ay appendicitis. Okay? Ulcerative colitis and diverticulitis. Okay? Same gyapon, class, because giving a laxative while having this disorders will also increase GI pressure. Okay? It will also increase GI pressure. So maghuot ang imong GI tract, anak class, maghuot, no? Sige lang, that's more for your MS. Just remember those, no? So there are 4 classifications. Okay, so what is constipation? Now, constipation, class, is the accumulation of hard fecal matter. This will cause, the, wait, sama to. This will cause a slowdown or the stoppage of stool movement, which is the basis for our constipation. Now, remember, constipation, class, is the inability, no? Or inability or difficulty to excrete or defecate stool, okay, or tae, di ba? Tae, no? So there are a few pathologies. First is colonic motility dysfunction, which this is when peristalsis stops. Peristalsis stops. Okay, very simple, no? No or less peristalsis. This will lead to accumulation of stool, and eventually it will lead to a blockage, causing your constipation. Next is pelvic floor dysfunction. This is when the pelvic muscles, such as those found in the rectum, fail to expel stool. Okay? And oftentimes, same gapon, class, it will lead to the accumulation of stool and lead to a blockage. Endocrine and metabolic disorders, no? Hypothyroidism and hypercalcemia often lead or slows down GI, slows down GI functioning. Okay? Slows down GI functioning, leading to constipation. Okay? Constipation. Calcium. Yeah? Hypercalcemia leads to a slowdown of GI function. No? Another is a bowel obstruction, either caused by either a tumor, okay, adhesions, or narrowing or stenosis. Okay, GI stenosis. All 3 of these could cause a blockage. And this blockage is the basis for constipation. And lastly is lifestyle and dietary. The lack of fibers. Lack of fiber in diet. And the lack of fluids. Can cause what we call a hard stool. And eventually that will lead to a blockage as well. Di ba? So, mo po na siya, class, another sign and another causative agent for what we call constipation. So, let's start with our first laxative, which is our osmotic laxatives. Osmotic laxatives add saline products, lactulose and glycerin to stool, pulling water into the GI tract and increasing the bulk of stool, making the stool soft. Okay? Making the stool soft. No? So what it does is very simple. If this is your GI tract, tanawa ha, o drawing nangyari. If this is your GI tract, okay? Wait sa to kong pen. No? And this is the stool. What our osmotic laxatives does is that it will put, it will put different solutes like saline, lactulose in your stool. And because of that, class, water will be pulled into your stool. Water will be pulled into the GI tract, and because of that, it will make the stool soft, allowing it to pass easily in your GI tract. Makalibang ra ka, no? So, here's our example class, glycerin lactulose, magnesium citrate, magnesium hydroxide or milk of magnesia, and magnesium oxide, no? So what are the indications for these drugs? Indications. Number 1, the first indication is for bowel prep. Okay? Bowel preparation for diagnostic and surgical procedures. Okay? What I mean by that, okay? What I mean by bowel preparation is that before we have a diagnostic procedure or surgical procedure that involves the bowel, let's say for example, class, a ileostomy, okay, or a colonoscopy, wherein they will put a probe or a camera inside your colon, no, a colonoscopy to visualize the colon. You need to have a laxative so that you will evacuate the stool. Imoy pagawas ang tae. And then once the stool is evacuated, then you are now able to freely insert the colonoscope. Okay? The second indication is obviously for constipation. Malamang, di ba? Okay, let's continue. What are our nursing considerations? Number 1, monitor serum electrolytes. Very important because a portion of the electrolytes will be absorbed in the GI tract. Assess the renal function because impaired renal function alters the ability to remove excess salt and magnesium. Remember, most of these will add salt through your saline product or they are magnesium based. And both of these two elements, no, both of these two elements are excreted by your kidneys. That's why we need to assess the renal function. How do we assess the renal function, Manggod? What do we check? We check 3 variables. I don't know if you still remember, class, our CREA, our BUN, and then our urine output. CREA, BUN, urine output. This is contraindicated in patients with heart failure. Contraindicated in patients with heart failure because this can cause, no, excessive use of laxatives can cause dehydration. Okay? Watch out for hypermagnesemia. Since most of these are magnesium-based, it could increase the magnesium in your blood, no? So the signs and symptoms will include drowsiness, weakness, paralysis, complete heart block, and respiratory depression. Okay? For the first 3, you need to monitor lang. Continue monitoring. However, for the next 2, okay, you need to report to the MD. Report to MD. Okay? Ayan. No? Next is another type of osmotic laxative is our polyethylene glycol, also known as our Go Lightly. Okay? This is also an osmotic diuretic. Now, this is unabsorbable. Meaning to say, if it enters the GI tract will not absorb this into the bloodstream. Okay? It will not be absorbed in the bloodstream. It will stay in the GI tract. And because of that, class, it can be used for, okay, listen to me, patients with kidney or cardiac disorders. And the reason why is because it will not go to the bloodstream. Diba? Dili siya mo to sa bloodstream. It will not go to the bloodstream. And because of that, class, it is easily excreted through your GI tract. Diba? This is also isotonic. Okay? Because it is isotonic, class, large amounts can be taken. Okay? Usually around 3 to 4 liters per hour over 3 hours. Okay? Namuta na kanako, sir, what do we use this drug for? What do we use our polyethylene glycol? This is used for, listen to me, pre-surgical bowel preparation. So usually we give this class at night. We give this at night before a surgery to clear out the entire bowel. No? This is filled with sodium salts and potassium chloride. Because remember, both of these elements, or both of these compounds, no, will pull water into the GI tract. And because of that, class, it will make the stool soft. Diba? And it will allow it to be defecated. Ayan, diba? No? Next type of our laxative is our stimulant laxative. Kini mga stimulant laxative, class, they work by increasing peristalsis. They make the GI tract move much faster by irritating sensory nerve endings in the GI. An example of this one, class, is Bisacodil. No? Bisacodil, or also known as Dulcolax. Dulcolax is often used to empty bowel prior to, listen to me, diagnostic exams. Ayan. Okay? However, this is rarely used. Okay? Rarely used for constipation, especially in the hospital, class, no? Dulcolax is rarely used in the for constipation. Next is our Senna or Senacot. This is the most abused laxatives. Most abused laxative. Naman ko yung mga yan, class, there are some patients who will abuse laxatives to make their defecation much easier. The reason why it's most abused is oftentimes it is over the counter, no? Castor oil is a purgative. This is very fast action, and produces very watery stool. Okay? But basically they have the same action, no? It increases peristalsis by irritating sa mukon ang imong sensory nerve endings in the GI, causing the smooth muscles to contract and relax, no? What are our nursing considerations for our stimulant laxatives? Number 1, monitor for fluid and electrolyte imbalance. Do not overuse. Okay, do not overuse, no? Especially potassium and calcium. Oftentimes they will be decreased when you are taking stimulants, when taking stimulant laxatives, no? They will be decreased. Watch out for mild cramping and diarrhea. This is because this is due to the decrease in calcium. Okay? This is due to the decrease in calcium caused by the sudden defecation. Castor oil is contraindicated in pregnant patients because castor oil, no, there's a big might there, might be absorbed by your, or might be transferred by through your placental barrier. Okay? Increase oral fluid intake to avoid dehydration and dry hard stools. Instruct the patient to take only with water to increase absorption, and encourage a high fiber diet. A high fiber diet, no, increases stool bulk. Okay? Increases stool bulk. Now, if the stool is bulky, class, it's solid, no? Solid but soft. Solid but soft. Allowing it to pass easily. Not as a watery stool anymore. Okay? Next is our bulk-forming laxatives. These are filled with fibrous substances that absorb water into the intestines, increasing the bulk and peristalsis, which leads to large, solid but soft stools. Muna siyang key there, soft stools, no? And we have a few. Nata atong best friend diri class atong polyethylene glycol. This is also a bulk-forming laxative. Okay? So the first is our polycarbophil. The key here, the nice part about our polycarbophil is it is non-absorbable. Similar to our golightly, no? So remember, this is good for patients with kidney disorders and cardiac problems. Okay? Our polyethylene glycol, we already know this, no? The key here about this is that this is non-addictive. No? Non-addictive. What we mean by that is it does not cause laxative dependence. Okay? Our methyl cellulose, no? It's very similar to our other book forming. Very similar to our other book forming. Our methyl cellulose and psyllium, no? They are the same as our other bulk forming laxatives. However, wala sila yung mga na qualities. Okay? For all, we have to remember that this is the common side effects are nausea, okay, vomiting, flatus. When we say flatus, kas constant farting, mag-utot, di ba? And diarrhea. Okay? And it is indicated for, imo ni siyang crucial part, honey class, indications, this is indicated for constipation na naman. Constipation and bowel prep. I think mora gini silang duha class, constipation and bowel preparation. No? So what do we need to remember when it comes to our nursing considerations for these drugs? If powdered, mix drug with water immediately to dissolve. This is to avoid GI obstruction. Usually, class, if powdered class, we need to mix it with water so that it will be dissolved in the water. Diba? Because if you take it directly as a powder, there's a chance that it will be solid inside the GI tract. Okay? So that's the reason why do not swallow if it is powdered, because it might becomes solid in GI tract if not mixed with water. Ayan. Diba? Instruct the patient to avoid overuse of laxatives. Okay? Because this can lead to fluid and electrolyte imbalances. Diba? As I mentioned before, this can cause diarrhea. If you take a lot of laxatives, ang ending na class is it might cause diarrhea and it can lead to fluid and electrolyte imbalances. Diba? Prior to administration, identify the direct cause of the constipation. Ano man? Because we must address cause first. Address direct cause first. Okay? And then increase oral fluid intake. This is just to prevent dehydration. Diba kayo? Sige makagkalibang, no? So we must prevent dehydration. Okay, so balik-balik na siya talang class, no? It's mostly the same. And lastly, class, is our emollients. Emollients, also known as our stool softeners. Okay? What they do is they lubricate the surface of the GI tract and soften the stool, decreasing the strain during defecation. Now, this one is quite different. Okay? Ang iyang indications, class, there are two. Okay? Iyang indications, there are two. Number one is this is for the prevention. That is the keyword there, ha? Prevention of constipation. Okay? Prevention of constipation. And number two is for fecal impaction. When we say fecal impaction, class, this is when there is a stool blocking the GI tract. Okay? And the reason why this is good for fecal impaction is, remember, it will lubricate. Even if it is blocked there, as long as it lubricates, because it's able to pass. Di ba? So there are a few class, no? We have our mineral oil, and our docosate sodium and docosate calcium. Our mineral oil class or chondromol plane, okay, this one is the lubricant. This one is the lubricant, no? So, and another effect it has is that it increases water retention in stool. Because it increases the water retention in stool class, the more water is in your GI tract, the more lubricated your GI tract is, the more soft your stool is. However, when it comes to stool softener, docosate is the one that we use often for a stool softener. Pahumuko niya ang tae. Okay? And same gyapon class, it increases water retention in stool, but much more potent. Okay? Compared to mineral oil. Mas kusgan siya kumpara sa mineral oil. Okay? So what are our nursing considerations for these types of drugs? Number 1, since this is for prevention of constipation, we give this given prior to administration of other laxatives. Okay? The reason why is this will prevent or decrease straining. When we say straining, kana bitong it's the pushing motion when you are trying to defecate. Kana bitong muutong ba para malibang, no? Is to decrease straining by softening the stool, okay? Allowing for the stool to pass with other laxatives. Okay? Number 2 is that the side effects are nausea, balik na lang, diarrhea, of course, because this is a laxative, and abdominal cramping. Abdominal cramping. Okay, ayan, no? And number 3, the thing you need to remember here, dapat niyo dumduman, is that this is contraindicated. Okay? In patients with inflammatory bowel disorders, okay, inflammatory GI disorders, and pregnancy. Okay? Lagyan mo to ng malaking star class, okay? So kana, that is for our emollient stool softeners, no? They are quite simple drugs class actually class because their mechanism is very straightforward. Their mechanisms are very straightforward. They are not like the other drugs that we have discussed before, that they have lots of side effects. Most often than not, their side effects are tied to their actual effect. What I mean by that is, if for example, a patient has constipation, then you will give them laxatives. A laxative forces or causes you to defecate. So when you are taking a laxative, there is a very high chance that you will get diarrhea. Whereas, if the patient has diarrhea, if ang imong pasyente na ay diarrhea, what you are gonna give them, you are gonna give them what we call so ito yung hatag nila class, anti-diarrheal. These are drugs that are used to treat diarrhea by slowing down or stopping diarrhea. And because you are stopping the defecation, then it might cause constipation. Mura sila magbaylo. Mura sila opposites ba? Di ba? They are like opposites. Now, if you are gonna ask me, class, di ba? Sir, naatay anti-emetics. Sir, do we also have emetic drugs? Okay? Emetics. Okay? Emetics are drugs that cause vomiting. They are typically used for expulsion of poisons, toxins, and alcohol. Okay? And there is one, na usa. It is called Epicac. However, I am not discussing this anymore. I'm not gonna discuss it anymore because Epicac is no longer used. Gibawalan na siya gamit. Instead, if we want to cause vomiting, if we want to induce vomiting, what we do now is we basically stimulate the gag reflex.